Dr. Evan Schwindt here with MYo Lab. Today we're going to talk about what to do when you wake up with back pain. Remember to please comment, like, and subscribe. So you woke up with back pain, went to bed feeling fine, had a great sleep. Somehow though you woke up and you are in excruciating low back pain. Not sure if you're going to be able to make it into work, out to the hill, or out to see your family today. Well, let's get into it. So believe it or not, this is actually a super common injury. Something that over half of the people that we see in MYo Lab come in with a flare-up or an inciting injury due to sleeping, actually. Question is, how did that happen? I went to bed feeling great, had a great sleep, didn't wake up restless throughout the night. My sheets are barely even turned around. Why am I waking up with such bad back pain? It's not like I did a workout, had an injury, slipped on the ice. Why does this make any sense when all I was doing was sleeping? Well, simply put, when we're sleeping, of course, we're relaxed. And if we're relaxed, we're not using our deep core muscles to engage and support our spine. So actually it does make sense for why so many people wake up with back pain. Any slight little movement that if you were typically moving throughout the day and you were thinking about that movement can now become a substantial injurious factor to your lower back. Now, of course, there's also conversation about your bed, the mattress, and everyone's gonna be a little bit different. So I'm not here to tell you that one mattress, firm, soft, medium, is the best for you. That's something that you're gonna have to figure out on your own journey. But ultimately, if you're feeling like you wake up with pain and you go to bed without it, there's probably something going on with either the mattress, your pillow, or if you're just super restless through the night. So it's worth checking into that. A fun fact for how your body responds while you're sleeping. Well, of course you're relaxing. So while you're relaxing, the tissues like the cartilage in your knees, your joints, even the intervertebral discs will actually expand back to their regular or resting positions, which means when you wake up, you're gonna be about a centimeter taller on average. So when you wake up, you actually do have more fluid through the tissues. Now, of course, the body's still pumping and circulating, but not to the same extent as when we're walking around, as our muscles are pushing that fluid through our body. So we will wake up with a little bit more fluid tissue density, as well as another centimeter of intervertebral and joint height. That's all going to contribute to why sometimes we wake up feeling like a small car hit us. Okay, so first and foremost, let's do the scenario where you are waking up and you're trying to get out of bed, but that low back pain quickly grabs onto you and you feel like you're stuck in bed. Well, surely you can't stay in bed all day long. So how can we get you out of bed and then into a safe position so we can begin to start that healing process? So let's take it back to the bed. Now, you'll recall how I sat up initially, which is how so many people get up out of bed. And if you think about how many times you're doing this in your life and the amount of pressure it causes on your spine, you can start to see why getting out of bed is such a difficult activity for many people. So just to replay that, so many people get up in a bit of a crunch position. Now remember, the tissues have been spreading out all night long. We have more fluid in our body. So doing that can suddenly start to squish and pressurize your nervous system in a way that you're not used to before you went to bed. So getting up like this is sure to cause an injury at some point. So safe way, let's get you out of bed. Roll onto your side, let those legs drop off the side of your bed. Top hand is going to be pushing down on the bed to press you up. Then you support yourself with the other hand into a seated position. Now the thing with that movement is my lower back did not bend at all. All the movements come from my hips and my shoulders. If I go right back down into this position, my lower back is stable. And remember, that's the part that hurts. So let's not hurt it more by continuing to overuse it and move it. Remember, legs off to the side, top arm presses down. Once you're able to, get the bottom arm underneath and finish that press up, keeping your spine straight the entire time. Now that we're seated up in a nice, safe position, let's think about why do we have pain here again? Well, without a nervous system and nerves, you won't have pain. So to reduce that pain, we need to decompress the nervous system. Now remember, right now you're in acute pain, maybe 8, 9 out of 10 for pain. You're not trying to do big movements. We're gonna keep it simple. A technique that we utilize at MYo Lab that helps so many people is oblique breathing. Now click the link below in the description for a more in-depth video of oblique breathing. But for right now, we're just gonna give you more of a concise version. So as we're seated, we're gonna be focusing on breathing through these oblique muscles. Not the belly button, definitely not the chest. So we can put our fingers slightly into the oblique muscles, halfway between your belly button and the flank on the outside part of your abdominal muscles. Lightly press in, about a centimeter or two, and breathe in to push that out. So this is more than just breathing. When we do that, we're expanding the rib cage and actually creating a taller spine, ever so slightly decompressing our discs, which again is where the nerves are coming out of that are causing this pain. So before we get out of bed now fully, we want to make sure that we have reduced the pain by doing some slow, oblique, parasympathetic breathing. So continue to do this until you feel the pain has reduced to a level where you're going to be able to stand up. And for most people, that's going to take 3 to 5 minutes. Next step, call your chiropractor. All right, now after you've done that, we're still experiencing some of that pain. So we're going to do a technique called PNF Pubis. Again, click the link in the description below for more detail. But briefly, how we're going to do this is simply use your fist in between your knees. You're going to be squeezing in as hard as you possibly can for 10 seconds. Let that relax. Then go out against your hands for another 10 seconds. We're going to do 3 sets of this. Now, when you're squeezing in, we're actually moving this pubic symphysis bone, the joint itself, I should say. We're opening it up both in the front and the back, gapping it to create some motion. We're doing this so we can start to utilize our pelvis and our hips better. Take that load off of our lower back. So again, 3 sets, 10 seconds in, 10 seconds out. You might get an audible click in the pubic region. Don't worry, that's normal. In fact, that's a good thing. That means you're getting motion and we're 1 step closer to getting you out of bed and on with your day. Unfortunately, nature calls, so it's time to get up. Now remember, when you're in low back pain, your body and your mind communicate to shut off your core. Seems kind of silly, but it does that as a protective mechanism to reduce our movements and allow our body to rest. But we've just done a bunch of steps to get ourselves ready and prepared to safely move. So it's time to get up, activate the core, get the body and the muscles pumping and circulating better. So safely get yourself up, moving through the hips, not bending through your back. Again, spine stays straight. Get out of that squat position. Now, we're gonna walk over to the bathroom. Now we're gonna be alternating arm and leg here as we're walking. Think Vince McMahon, Conor McGregor, as big, strong, and egotistical walk as you possibly can to keep your spine stable and your core activated. Let's go. So here we are. Now you need to sit down in a safe manner so that way you can get back up. You probably aren't blessed to have handrails like this. If you do, you're in a good spot. Make sure you utilize those handrails to support yourself as you're coming down. Now, as we're doing this, it's okay to support yourself through your quads. You're gonna be leaning back through your hips. Now remember, spine does not move. Common error is this, and you're gonna feel that immediately, which might put you on the floor. So be careful. Slowly sitting down, back into the hips, and then do your business. All right, once we're done with that, we need to load through our hips, not our knees, and keep that back straight. So pushing through the hips, if you need to support yourself through the quads in this manner, that's gonna be okay, but we wanna push up on the higher part of the quads as opposed to the knee. If you load the knee, you're gonna shift your weight forward, which is probably gonna hurt the back. Hold your breath, brace, oblique breathing, come on up. Now it's time to grab your toothbrush and get that part of your day started too. Interestingly enough, this can be an activity that actually does create a lot of back pain for people, because again, we don't think about what we're doing when we're brushing. So go ahead and support yourself on the counter. Do a little bit of a split squat position to take some pressure off of your hips, and continue the brushing. Again, you're supporting through here. A lot of people end up rounding through, especially as they go to spit it out. So push your hips back, get down to the sink, and continue. Seems like a kind of a funny thing to talk about, but so many people come in because they have actually injured their back after all of this, suddenly when they're brushing their teeth. All right, now that we've gotten the body moving around, reducing that pain, improving our circulation, starting to lightly activate our core, one more final elementary tip here is gonna be some lacrosse ball or tennis ball rolling of your glutes. Why are we dealing with the glutes when our lower back hurts? Good question. Well, ultimately, we're gonna be doing this because we wanna move through our hips better. If our hips are tight, we're not gonna move through them. Instead, we're gonna continue to load that lower back, causing further injury. So the more mobility we have in our hips, the better our low back is gonna feel. Grab that lacrosse ball or tennis ball. You're gonna place it right underneath either of your glutes. You're gonna simply roll around until you find a spot where you're feeling like about a 6 out of 10 for pain. Once you find that spot, you can either first just statically sit into it until the pain reduces by half. Second, you can increase it by moving around until the pain reduces by half. Or third, the furthest step of this is going to be to move your body until the pain reduces by half. There's no right or wrong way to do this. Everyone's body's a bit different, and the tissues may be damaged differently for you than they would be for me in this specific situation. So it's not about everybody going at a certain angle, certain degree, certain reps, but rather listening to your body and finding the sore spot. If you're on a spot and it's not bothersome with a lacrosse ball underneath it, it probably doesn't need to be worked on. Do that equally on both sides. Ideally, you could find 3 spots per glute, right and left side. Let that pain reduce by half, which is typically 3 to 5 minutes per spot. And we're gonna be in a better spot to continue to move better through our hips. Now, if the problem is still persistent at this point, I highly recommend you consult a professional. Be that your personal trainer, physiotherapist, chiropractor, massage therapist, acupuncturist, any list of these practitioners that specialize in biomechanics and movement. Now is a great time to go talk to them. Don't wait 2, 3, 4 days for your body to seize up and get more and more into this movement pattern of dysfunction, but rather deal with that today. Hope you've learned something today, and I look forward to seeing you next time.